Hi there, folks. I am happy to connect with you before you interview with us for Global Health Electives that we're hoping we'll be able to offer to you folks. Things, of course, are quite up in the air right now, but we decided that if we didn't go ahead with the application process and the selection and matching process, if we didn't do it on schedule, we wouldn't be prepared in the likelihood or with the hope that these rotations will be offered. And it's possible that some will be offered and won't, depending upon conditions in individual countries. One of the electives, the elective in India, requires processing of the applications about 6 months in advance with the Indian government and our partners in Mumbai, even though conditions are still currently not great at all in India. They've asked us to proceed with the process, and for students that may be going to India, for us to go ahead with the processing of their applications with the Indian government, just to make sure that things are in order in time to participate if they're able to participate. So usually I do this overview in person, and I do it over and over and over again with multiple cohorts that are interviewing. And to make our day more efficient, we decided that this year I would just record it. You can listen to it at your leisure. I apologize that I'm not getting this to you sooner before the interview, before your interview day. It's Thursday night, and I am on a break at 8 o'clock in between MSPE meetings. We're almost down the home stretch, but not quite there yet. So I'm taking a little break to share with you some key information that we'd like you to know. First, in general, about the electives program, and then I'm going to go through some specifics about the individual sites. So the first thing is really the uncertainty of the program that I've already highlighted. And if students are able to participate, we'll of course need to follow CDC guidelines and travel restrictions that are related to specific destinations. So that's more of we have to all stay tuned on that one. A little bit about the funds that are provided and the stipends and the funding that we're providing will cover many of your expenses, but they're not likely to cover all of your expenses. So I just want you to know that there may be some additional costs that you'll need to absorb depending upon the site which you're going, where you decide to stay for housing, etc. Your flights will be booked and paid for by Vegeta, and then there will be an additional stipend above that related to anticipated expenses for your destination. The next point that I want to bring up is related to the flexibility of assignments. And I'll tell you, years ago, we placed 8 or 10 students, and then it went up and up and up. And one year we had 40 senior students who applied, and we didn't have the funding and we didn't have the site capacity. And then we went to Dean Martin, and she said, well, we'll provide the extra funding if you could find the sites. And then we got on the phone and sent email messages to ask our partner sites if they could accommodate additional students. Some places we had 2 cohorts going, 3 weeks, followed by another 3-week rotation, and we made it work. It absolutely requires, though, flexibility on your part. And after we finish all of the interviews, it's kind of like a jigsaw puzzle. We're going to sit down and try to place folks where we can place folks based on capacity and based upon your choices, the choices that you submitted with your application. You will have 3 very quick interviews. Your time with me will be an opportunity for me to just talk about your preferences so that I get a better feel for how strongly you feel about one versus another. But we appreciate your flexibility and understanding, and we'll do the best that we can. There are about 30 folks this year who have applied for the program. The next thing I have on my list, on my summary list, it's called Carrying the UCLA Flag. And I just want to remind you folks that you are our emissaries around the world, and many of these programs were established because we built upon existing research relationships or training partnerships and asked our global health partners to accommodate students. The spirit of this is that we worked very hard for our partnerships to be really equally or much more beneficial to our partners. We don't want to create any additional burden. So as an example, in Mozambique, we have a full-time pediatrician who's working there and helping them to build their training program. You'll hear more about that in a moment. But then once that relationship was established, we asked our partners if it would be okay if students came for a few weeks to work with Chris and experience medicine in that setting. So obviously, all the things that you would think about here for professionalism, not practicing beyond your level of training, all of those things apply when you are working in global health settings. I just want to mention a couple of required sessions. This was in the information that was posted related to each site, but there are two required sessions. One is the pre-departure training session on Saturday, February 12th. This is an all-day, almost all-day program. It's usually quite fun with everyone participating in global health electives coming together for this day, but there are breakout groups that are either country or continent specific to talk about some of the logistical issues, cultural issues, oftentimes discussing some of the most common forms of morbidity and mortality in that corner of the world, et cetera. And then right before graduation, on the day before graduation, that Thursday, June 2nd, from 12 to 2, we have an in-person feedback session. That's great fun to hear about the experiences from everyone. You will have an opportunity, though, to be sharing your experiences in real time by participating in a reflection blog, but you'll hear more about that from Tracy at the orientation, at the all-day pre-departure training sessions. And we have a couple of different sessions when we're going to be interviewing students in your class. So we just ask that you please maintain the confidentiality of the questions. They are 3 little MMI-like rooms, just 5 minutes or so each, and it's an opportunity for you to, for me, just to talk about your interests in particular sites. But in the other 2 rooms, I've not heard the questions yet this year, so I can't speak to them, but it's usually a little bit a question about how you would handle a situation in a global health setting. And so let me give you now a quick overview of the partnerships and the opportunities for which you may be applying today. So we'll do it by continents, and I'll start in Africa. In Africa, there are 2 partner sites or elective sites, and they're very, very different from one another. The first one is at Cape Town, and this is at Somerset Hospital. Somerset is a major teaching affiliate of the University of Cape Town School of Medicine. It's kind of like their Harbor UCLA kind of hospital. So I would say Somerset is to the University of Cape Town as Harbor UCLA is to DGSOM. And it's a popular training site for UCT medical students and residents. And at UCT, you can, they have many specialty and subspecialty services. Our students have traditionally participated in elective rotations in the emergency department, in internal medicine, and in pediatrics. Over the years, we have also had students spend time in the OBGYN service and also on the psychiatry service. This is a site that fills up with international students more than 2 years in advance. It's very popular. There'll be students from all around the world there, but they reserve these slots for UCLA students each year. And we have a long-standing great relationship with them. This is more of a hands-on experience. As I go through these, some are more hands-on and some are more observational, but this will be more like doing a sub-internship. The medicine, it's the practice of medicine may not feel too different, rounding on the wards, for example, but the patients are going to be very different, and there'll be significant differences in the spectrum of pathology in this setting. The medical students at the University of Cape Town have a mobile clinic project similar to the student-run homeless clinic and the mobile clinic project, and that's called SHAWCO. You could Google it. It's excuse me, SHAWCO, SHAWCO. And in years past, we've had our medical students go out with the UCT medical students on the mobile van into some of the outskirts of the city for mobile clinics. So that's Cape Town. Literally on the other end of the spectrum, and also on the far other end of the country, is a rotation that we've established at a new site in rural KwaZulu-Natal. And the big city in KwaZulu-Natal is Durban, and from Durban, it's probably a 4-hour drive to this hospital. We've not sent medical students to this particular hospital before. We sent students to another hospital. It was an incredibly rich experience, and it was made extra special because of the head physician, who was an amazing teacher and provided a great experience. He has since moved on, and we learned of someone who is similarly dynamic and very, very enthusiastic at another one of another government first level hospital. It's a little bit closer to the coast than the other hospital. And Chris Buck, who's our pediatrician in Mozambique, will be driving to South Africa to visit with the leadership. We have Zoom with the folks there, and it sounds like a great opportunity. I would actually love to do this experience myself. It's actually, I'd love to do all of them myself, but this has got a sense of adventure. They all have a sense of adventure, but this one, it has a different level of adventure. You would arrive together, likely 3 of you would arrive together in either Johannesburg or preferably Durban, because it will be closer to the site. And you will have a 4-hour drive from Durban. So you're going to be renting a car together. One of you is going to be the designated driver, and it's usually stick shift driving on the other side of the road. And it's an adventure because you're taking off and driving through the South African countryside. And it's between a 3 and 4 hour drive. And then you pull into this village that we've not yet seen, saw the other one. And there are some neat places where the students can stay, and it's very close to the coastline. And actually, it's not that far from Mozambique, so there would be opportunities to visit with your classmates who will be in Mozambique, and vice versa. So this is a primary care experience. It is a first level hospital. I shouldn't say it's inpatient primary care, and that they're primary care providers who are doing inpatient care. It's mostly inpatient and emergency department. And it's a team of incredibly well-trained family physicians who they do it all. They will do the anesthesia in the delivery room. They'll do the C-sections. They'll resuscitate the babies, but then run to a code in the emergency room. They're incredibly talented clinicians, and the folks with whom we've worked to date have been very enthusiastic teachers, and there'd be an opportunity to spend time in the emergency department on internal medicine, in pediatrics, or in OBGYN, and we'd likely be able to tailor the experience depending upon your interest. And this will be a hands-on experience as well. Students participating in either the Cape Town or the Rural South Africa elective will need to be registered with the medical board equivalent in the Republic of South Africa, and we will facilitate that for you. Okay, also in Sub-Saharan Africa is a rotation in Malawi. This is in Lilongwe, and this is a very long-standing partnership with colleagues in the Department of Internal Medicine. There is a faith-based organization there called Partners in Hope, and they have been partners with UCLA for research projects and clinical projects and training partnerships. The UCLA internal medicine residents pre-pandemic went there with great regularity. There's almost a resident almost all the time going through the year, with UCLA faculty members going over for multiple blocks per year. This is mostly an outpatient experience, although there is an inpatient component to it. It's mostly an adult experience, although you'll see some children, and there's a heavy emphasis on HIV treatment, although there's a lot of general medicine as well. It's an opportunity to visit the large and experience the large public hospital in Lilongwe as well. And you will likely, if we're able to send students this year, you will likely be taught by local clinical officers and healthcare providers, with a good chance of overlapping with a UCLA internal medicine resident and or faculty attending. Further to the east along the coast is Mozambique, and Mozambique is a Portuguese-speaking country. It's not a requirement to participate, but if you have some, well, clearly if you speak Portuguese, that would be amazing, but if you're somewhat conversant in Spanish, that will help a bit while you're there. But Chris Buck will be there with you, and he is a phenomenal teacher. He's a UCLA faculty member who is sort of seconded to Maputo. He's been running our show there for 4 or 5 years now. He's now an associate professor in the Department of Peds. This is a partnership that I established 12 years ago when I set up a nonprofit called Partners for Pediatric Progress, set it up under the UCLA umbrella. And the mission is to provide training and support for healthcare providers who care for children in low resource settings around the world. When Risa and I visited Mozambique to explore this as a partner site, at the time there were 10 million children and there were 10 pediatricians in the entire country. And this was a nation that was fraught with many years of civil war. After gaining their independence from Portugal, there weren't physicians in the pipeline. And so there are now lots of physicians in the medical school pipeline, and we've contributed to the training of their pediatric residents and also the pediatric surgeons in the country. This is a huge teaching hospital. It's about a 1,500 bed teaching hospital. Think of Reagan as 400 or 500. This is 1,500, and in the busy season has an average daily census of 3,000. So you may see 2 children together in sharing a bed with one another. This is more observational. The patients may or may not even speak Portuguese. They may be speaking one of the local tribal languages, and the most common of which is Xangana. So it's more of a shadowing experience. But you'll see an incredible spectrum of pathology and learn a lot about another healthcare system. Mostly inpatient, working in different settings in the hospital, an ID ward, an infant ward, etc. But Chris will also take you to some outpatient settings in the city, so you can get a feel for that. All right, so those are our 4 opportunities in Sub-Saharan Africa. In Asia, there are 3 options. One is in China, and this is in the city of Hangzhou, and it's, and I know I'm not pronouncing it correctly, but it's Zhejiang University, which has been partnered in many projects with UCLA over the years. And this is a beautiful, beautiful city. It's called the City of Lakes. It's a vacation destination for the Chinese. And this medical school there, Zhejiang University, has many teaching hospitals, and they're called Affiliate 1 and Affiliate 2. They're numbered, and our medical students go to Affiliate Hospital number 2. The first week, you can choose to rotate on a specialty of your choice. The second week is traditional Chinese medicine. And the third week, all of the students who are there go with local medical students to a more rural community for 4 or 5 days to experience primary care far from the city. It's the community in which students have gone is about 2 hours away from Hangzhou. So it's Shanghai is the nearest big city, then it's a 2-hour drive or train ride to Hangzhou, and then another 2-hour ride to the rural community. You would be there with medical students who are bilingual. We do ask that students who are participating in this speak some Mandarin to be able to get as much as possible out of the experience. And some students have chosen to do both weeks at the second affiliate hospital on the traditional Chinese medicine service, and then 1 week in the rural community. All right, in Thailand, the Thai experience is at Siriraj Hospital, Mahidol University. It's one of the major, oldest hospitals and medical schools in Thailand. And you have an opportunity to spend time on the pediatric service, on the medicine service, both with an infectious diseases twist. It's usually general pediatrics and adult infectious diseases, but there's some flexibility there. And then a week of Thai massage. They have an amazing Thai massage center that they will introduce you to the ways in which this is incorporated into the care of patients there. And of course, you'll each experience a traditional Thai massage. It's a wonderful experience. And one of the newest ones that we've established is in India. We set this up 2.5, 3 years ago in Mumbai, but we've not been able to send students there yet because of the pandemic. This is at the King Edward Memorial Hospital in Mumbai. It's a major teaching affiliate for a top-tier medical school in India, and it is kind of like it's an incredible experience. There will be patients lined up around the block. They don't turn anyone away. It's an amazing experience, and this can be tailored to your subspecialty interests. But I think the services that we've established are internal medicine and pediatrics, and that's probably the easiest ones for us for our first year sending students should probably be one of those two, or a combination of those two, and potentially some time in the emergency department as well. The woman who set up this program for us is an alum of DGSOM. She's raised in Los Angeles and medical school here and internal medicine training at Cedars, but she raised her family in India, and she's been a wonderful partner for us. For those of you that are considering peds as an opportunity to do pediatrics at King Edward Memorial, and also one of the children's hospitals in Mumbai. All right, so that is Asia. And now in Latin America, you folks may have seen the YouTube video from the Today Show when they captured the experience of DGSOM students on the rotation in Iquitos. Iquitos is sort of the capital of the Amazon region of northern Peru. It's described as one of the densest cities in the world with no road access. It's an island city, and the only way in is by plane or by boat. The island has a population of 500,000 on the island, but the public hospital on the island not only serves the population on the island, that 500,000, but another 500,000 Peruvians living in rural northern Peru. And some of these communities are quite rural. And imagine branches of the Amazon branching into smaller and smaller tributaries and going to more and more remote villages. Some of the patients that we've seen there traveled by boat for 10, 12 days to get to medical attention in Iquitos. Some of them don't speak Spanish, they speak Quechuan, and it's an opportunity to do pediatrics or adult medicine. You will see the adult medicine is adult infectious diseases. You'll see snake bites, you'll see dengue, malaria. It's really an incredible experience. And our newest site of all is in Tijuana, Mexico. And this is a new partnership that we're building. It's at Refugee Health Alliance. And it's a clinic that has both American and Mexican clinicians who will be supervising you there just over the border. And they also have some satellite clinics, and you'd have the opportunity to participate in those as well. We've not yet been there. I'm planning to go down at the end of September. So for students who are, most interested in this site and rank this site highly, I'll be able to give you more scoop, but we have folks here at UCLA who can share their experience because there are UCLA folks who have worked in this setting, including leadership positions in this setting. So that is a not so quick overview of the sites. I just want to highlight that there are 2 sets of dates for these electives. All of the electives will be starting on the 3-week elective block right after match day, with the exception of the electives in Mozambique and South Africa. Both South Africa sites and Mozambique will be the next 3-week block. So most electives right after match day. Cape Town, rural South Africa, and Mozambique will start 3 weeks after match day. And that's it. So now I like to do this once a day rather than 5 times a day, but it's an opportunity to give you at least a basic foundation, and there'll be plenty of opportunities to ask questions. So we'll see you over the weekend or next week. And thank you so much for your interest. And now it's back to those MSPEs. See you soon.